From Hollywood celebrities to Wall Street investors, weight loss drugs are sparking a multi-billion-dollar wave in the West, and now it's India's turn. Novo Nordisk, the maker of the popular drug Ozempic, has launched Wegovy, its once-a-week injectable treatment for obesity, adding a new option for Indian patients after Eli Lilly's Mounjaro. With over 250 million Indians estimated to be suffering from obesity, can this drug help address the ticking time bomb of this lifestyle-related disease? To understand more about the drug and Novo Nordisk strategy for India, I have with me Vikrant Shrotriya, Managing Director of Novo Nordisk India. Welcome to Business Today, Vikrant. Thank you so much for joining us.
Thank you very much and pleasure to be here.
So let me begin by asking you that Wegovy's launch were initially slated for 2026, but you have fast-tracked its launch in India. So we just want to understand from you that what is it? Is it a global competition, or do you think there is a rise in demand in Indian population? So what is it? We want to understand it from you.
Yeah, and you know, my wish was to launch Wegovy as early as possible. It is just incidental that, we could able to get the stocks now in 2025. I don't think so it has anything to do with the competition, but it has something to do with the growing need. There is a gap in terms of the treatment which is supposed to be available for obesity. And I think me and my team were working relentlessly just to make sure how it can be accelerated. Despite the shortages which happened, we were continuing to try to bring it, but now we have got the assurance to have it available uninterrupted and across India availability. So Wegovy in 5 stents, that too in delivery devices, not in vials or syringes, will be available across India from now onwards.
So another important question I would like to ask you, what is the pricing of Wegovy in India? Considering the Indian population, we have a large population, massive rising obesity rates. So how are you ensuring to make it affordable for the Indian population?
I know that you would be interested in it, and many of the healthcare provider will be also interested in knowing it. And what we have done for Wegovy is, and we have learned from our previous GLP-1 and many other products, that we have come out with something called as a smart pricing, and that smart banding, you can say. So 0.25 is going to be available in 17,345, and that means weekly it is going to be 4,336 rupees, and 4 injections in 1 pen of 0.25. Now you will think that 0.5 could potentially be double because it's higher strength. But just to let you know that 0.5 milligram in delivery devices is also going to be available in 17,345. And then comes 1 milligram, which is Wegovy, going to be available in 17,345. So when people start at 0.25, they can progress till 1 milligram at the similar price without having a hole in their pocket. Then 1.7 milligram, we have priced it at 24,280, and then 2.4 milligram in 26,015 rupees. So it's quite a smart one. One pen will have 4 doses. So weekly price to start until 1 mg is 4,336. Color coded, convenient, with 4 needles inside. We are just making the Wegovy or Semaglutide administration much more easier for the patients at their home.
So what was the idea behind this pricing strategy? It's very interesting, if you can share that. What was the idea?
What we learned is that earlier GLP-1 or many of the medicines, as you progress and titrate higher doses, they had a linear pricing. And that was detrimental in terms of taking forward the medication and bringing the right control. So we wanted to help Indian patients so that they can actually progress from 0.25 to 1 milligram and even later on with a very convenient pricing, rather than thinking about it that we are moving from 0.25 to 0.5 and they might have to pay more, but now they have to pay the same price.
Great, that is definitely for the larger population. So you might have done some market surveys also before its launch. So is the demand clearly from the metropolitan areas in India, or do you also see an anticipating demand from tier 2 and tier 3 cities, because in India the obesity rates are anyway rising?
I would say that obesity is not biased. It's all across demographically. Yesterday only ICMR study came that whether it is urban or rural, it is prevalent across. India is actually having third largest obesity population with 254 million people. So obviously it is available everywhere. But having said that, there is a, you can say, genetic predisposition, urban lifestyle, that in urban population, obesity is at a higher percentage. So of course, when you see the proportionality of the drug to be used more could also be in the urban population. But then we have come and we are launching across India. So somebody wants to use it somewhere in a tehsil or a district will have an availability of semaglutide.
Oh, that's wonderful. So when we talk about your competitor Lilly that has recently launched Mounjaro a few months ago, see, when we look at the PharmaRack data, rupees 24 crore sales the drug has already clocked. So how are you positioning Wegovy, since it is, it is coming late to the market? So how are you positioning your drug, and how do you think it is a better option when you compare it with your competitor drug?
We welcome competition. That's the first thing. I think they are a good company as well. And from our side, we feel very strongly about semaglutide. Now, look at few things which sets us apart. 1 in 3 reach up to 20% weight loss. And not only that, there is a 20% CVD risk reduction. That means the cardiovascular risk reduction. That's unique to semaglutide at this point of a time as a weight loss drug. And then we are launching in 5 strengths from 0.25, 0.5, 1 milligram, 1.7 milligram and 2.4. And the first 3 strengths are at the same price, and they are actually in state-of-art delivery devices. And that is what we feel is very important to Indian doctors as well as patients. Regarding numbers, I don't think so we chase numbers. I think what we chase is dream to address obesity. And in that chasing, we are one of the very strong players. And there can be the need of many other players, government, communities, families. Everybody will have to come together to fight against obesity. And I finally say that it's the patient who has to fight against obesity. And we are there for them. We have shown that in diabetes for the last 4 decades. And in this journey when we are starting, we will be there with them to handhold in the journey of weight loss.
Okay, when we want to talk about the business perspective, since a similar drug Ozempic and Wegovy, both of these drugs are these are anti-obesity drugs. So both these drugs have significantly, contributed to the revenue of the company largely globally. So what kind of market share are you looking at in India, and how do you think the revenues will impact the overall business?
I think, there have been analysts who have been talking about how big this business can be. There have been various models, right from 25 billion worldwide to 150 billion worldwide, and so is in India. India is also the similar kind of a story. But what gives us is that we are coming out at this watershed movement to address something which is so important and so critical for the patients. But of course, that when you do good something and when the drug or the medicine and the services is very patient centric, the byproduct is also the revenue. So of course we have got big plans, but these plans are not limited by the numbers. We are not chasing the numbers. We are chasing the ambition to create that awareness and to create that access which is required for this disorder. So I know that sometimes you people get disheartened, but it's a fact. We really don't chase the top line numbers.
Okay, since the obesity is rising in India, and India has a massive population as we discussed, so we have seen that there has been a supply constraint for Wegovy and Ozempic in other markets. So since you are launching this product in India, how will you ensure that there is a consistent supply of this drug in the Indian population?
And very good questions, because in the last couple of years there have been news of different GLP-1 not being able to supply because of the constraint, because there was an unprecedented demand which got generated, and that is also the thing which we have tried taking care now when we are launching in India, that we are launching for India across India. So we have learned the lesson from our previous launches. We have calibrated that what could be the potential supply required, but we have also kept flexibility in terms of should the demand be very high. So I would say we have done a lot of checks and balances, but the market can always throw up a surprise. So fingers crossed that we will be able to cater to the market.
Ozempic and Wegovy both are very popular products of yours. So can we expect some more similar products in the pipeline for Indian market and globally? If you can share some data or maybe the products which are already in the pipeline of the company.
Yeah, and of course it's not only the brand Wegovy. Many of the Novo Nordisk products have always been very purposeful, and they have been always solving the real problem. Obesity is, I personally feel obesity is just started to begin in terms of the pharmacotherapy, and this is the start of the journey. Of course, we had earlier liraglutide, which was also available in the form of, for the treatment of obesity. Now we have got the semaglutide, and in future you can see we have got in phase 3 CagriSema, we have got amitriptyline, which is also going into the tablets as well as in injectable format. We also have oral sema, actually in higher dose strengths for obesity. So the pipeline is huge, the research is huge, and I think it is very promising what we are trying to address.
We have also seen that since the obesity rates are rising, there is a high demand of these drugs. There have been cases of black marketing and off-label use of these drugs, not only in India but globally. WHO has also flagged off. So what are the strategies in place from Novo Nordisk to ensure that there is a misuse of these drugs in India? Because in India we have seen that a lot of other anti-diabetes drugs are being used for anti-obesity purposes. So if you can share.
Yeah, and rightly said, because borders of India are quite long, and there are players who go for a quick money unethically. I think it has been a try, not only when we are launching but even before launch, to really find out if at all somebody is actually doing anything wrong with our products and selling it unethically. Of course, I also believe that with this launch which is happening, now the products are going to be available at an arm's length. So the propensity at which some of these products are coming should stop, and there should not be any reason with this kind of a pricing to be available that products to be imported and sold in India. But on the other side, when you are talking about the non-indicative use of these drugs, we strongly suggest not to use it. We have got enough population which requires it. More than 30 BMI, people with more than 27 BMI who have got comorbidity situation like dyslipidemia, hypertension, diabetes, they should be taking it. And lastly, I keep on telling that please do not self-treat yourself. Go to your doctor, talk to them, they know the best, and take the treatment from them.
Okay, are there any plans for the Indian market if we do not focus our discussion only on Wegovy? What are the other launches that you are looking at in the Indian market and globally as well, and any other markets that you are focusing on?
Yeah, right now I would say that with this comprehensive range of 5 strength, I think the job and the opportunity and the issue which is there in front of us is very large. You know, people look for next opportunity if the first opportunity is fulfilled. This is an opportunity of a lifetime, I can tell you. And this is so satisfying that we are addressing something which is really going to solve quite a lot of problem. You know, obesity is a disorder which is a gateway for 229 diseases. And reducing just 5% of the weight can reduce hypertension, can reduce the blood sugar in patients. Imagine 5 to 10% weight loss can reduce PCOS, can also bring some beneficial effect on fatty liver, can bring down type 2 diabetes, dyslipidemia. So the profound effect of the medication or to treat obesity are so huge that this opportunity is so big. Having said that, our R&D, we have got huge investment. We have been working on this next stage of the molecule which I just enumerated, as well as also in the space of other disease therapy area. And it has been our try that whenever we launch in India faster, and that we will continue to be committed.
How do you look at Indian market when you compare it with the other markets, and why is India an important market for Novo Nordisk? And considering the obesity burden in India, do you think that these kind of drugs like anti-obesity drugs only can tackle this ticking time bomb of this lifestyle disease?
See, we are one of the players who are playing our strong part. But alone we cannot do the justice. It's a time of collaboration and co-optation, to address the issue together. So alone we will require many players. Why players? We will require government, we will require communities, we will require doctors. We will also require the families to address this issue collectively, put together. I don't think so the issues like this which are so spread out in India is an issue. In fact, the recent study said that families, they get fat together. So in a family there are people with obesity, most probably the other members can have a probability of having an obesity. So it's an issue which has to be fought together. And I think we just want to play a very strong part in that.
Thank you, Vikrant, for taking time out for us. That was a wonderful conversation.
Thank you very much for having me and also joining the fight for obesity. Thank you very much.
Thank you so much. That was Vikrant Shrotriya from Novo Nordisk. As we continue to track this space, you stay tuned to Business Today for more updates.
Thank you very much.
If you like the video, do like, comment, share and subscribe.